Hi, my name is Vidisha Gupta. I am your host for today, and I welcome you to today's podcast, Win Over Hypertension, through which you can learn how to take control of your high blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why it matters, how is it caused, and most importantly, how to manage it effectively. Hello, doctor. It's my honor today to welcome you on this podcast, Win Over Hypertension. And I guess today we will be needing all your insights on how to manage high blood pressure and hypertension.
I am Dr. Sumitra, MD Medicine, MRCP. I have been practicing medicine for last more than 15 years. I am attached to Spandon Hospital, Kolkata and at other various clinics.
Okay, doctor. So, my first question to you today is we all know what hypertension is, but can you please elaborate on it? I mean, why is it so important that we take care even when we are feeling fine?
So the blood pressure, if it is, we all know the usual limit is 120 by 80 millimeter of mercury is the upper limit of normal blood pressure. Anything beyond that will be categorized as hypertension.
Doctor, why is it so often called the silent killer? What makes it so dangerous over time?
A lot of the times hypertension can be a silent killer also. Why? Because a person can live otherwise normally even if his blood pressure is high, and that can be up to any level of blood pressure. Patient might be asymptomatic, so it is mandatory to go for regular or intermittent checkups for blood pressure to identify whether he is having this silent hypertension and to find out that what is his actual blood pressure, and if it is high then we should definitely take some actions against that. And this silent hypertension, though it is not causing any symptoms, this might cause some kind of end organ damage like cardiac problems or renal dysfunction or some other kind of vascular issues. So we must be very careful to avoid this existence of this silent killer, that is silent hypertension.
What are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
Hypertension can broadly be categorized into two categories, like one is primary hypertension and another is secondary hypertension. The primary hypertension, most of the patients, like 90-95% patients usually have this primary hypertension, which means that the hypertension itself is the disease and it is not caused by any organ dysfunction or something. So there are some certain risk factors which contribute to this hypertension, development of this hypertension, but as such there is no organ involvement in the primary process that causes this hypertension. So most of the patients have this kind of primary hypertension, and this hypertension is related to a lot of risk factors which in most of the cases are modifiable. That means the patient can actually take care of those risk factors. What are those? The usual things are this lifestyle factors, like not having proper diet, lacking regular exercises and sleep pattern, work schedule, shift works, and this other stress related factors, and this habit forming things like alcohol, smoking, all these things, they contribute immensely to development of hypertension, and all these factors are usually modifiable by taking some actions on the part of the patient. And there are some non-modifiable factors also, like family history or genetic factors, which we actually cannot do much about, but the modifiable factors are more, and which we can actually take care of. There are a minor percentage of patients who have secondary hypertension, which can be hormonal related or some end organ related. Those cases require specific treatment and specific workups, but these are, again, I would say this percentage is very minimum, like 5 to 10% of the total number of hypertension patients. So the primary hypertension is the commonest one, and it is related to a lot of modifiable lifestyle risk factors.
How is blood pressure really diagnosed? Can you please elaborate on the exact numbers patients should look at by looking at their blood pressure readings?
When the blood pressure is slightly higher, like 130 the systolic and 80 to 85 diastolic, this is called somewhat pre-hypertensive stage or borderline state, where someone has just crossed the normal range and is going towards the hypertensive range. So and if it is beyond 140 and 90, then that should be considered as a frank hypertensive.
Okay, so for someone who's just been diagnosed with high blood pressure, what are the changes you would want them to make in their lifestyle first?
So initially we have to decide the level of blood pressure that that person is having, like whether this is just above the normal range or it is way beyond the normal range. Based on that, we can delay the initiation of medication, but we cannot delay the initiation of lifestyle changes, which definitely includes the control or reduction of intake of salt. So ideally a hypertensive person shouldn't take more than 2 to 3 grams of salt every day, and apart from that he should start doing some kind of exercise like walking, cycling, swimming, jogging, any kind of exercise for at least 30 to 40 minutes. And if he is overweight, for reduction of weight, he should do this exercise for at least 60 minutes every day. And another thing which is very important is the diet, what should be taken and what should not be taken. And so there is this standard protocol of DASH diet, which is the dietary approach to stop hypertension, which involves a few recommendations like to have healthy food and to avoid all sorts of fast food, junk food, oily food, all these things, and to avoid, cut down on sweets and sugar, and to have a lot of fruits, vegetables, green leafy vegetables, a lot of fibers and proteins also. So apart from this salt reduction, exercise, weight control, and dietary approach, one should also take care of his sleep. Sleep apnea is one very important risk factor for development of hypertension. So in case of hypertensive patient, we should also rule out that thing, whether that patient is having obstructive sleep apnea. If yes, then we should also take care of that.
So can we say that hypertension can be treated without medication also?
So this is a very important aspect, because right from the beginning, the patient should understand that our target is to control the blood pressure. Okay, so which the treatment part, obviously, as we have already discussed, involves drug therapy or medication, along with a lot of lifestyle modifications. So there are many instances where lifestyle modifications alone can control the blood pressure. So in those cases, the person would not require any medication. But if he comes up with a blood pressure of like more than 160, 180, then ideally medication should be started straight away and should be kept under close watch with regular monitoring. And even there is another question in this context that we usually face is, what if after taking a medication for like 2 weeks, 4 weeks, the blood pressure comes down to normal? Should you stop the medicine? Ideally no. You should always be under the guidance of a doctor, and the blood pressure needs to be monitored over time, and the dosage needs to be adjusted accordingly. Okay, so ideally the patient should not stop medication by himself or herself, because at many a times that can be very counterproductive, because once the medication is stopped, and blood pressure might just shoot up and to a dangerous level and cause some catastrophe. So if required, medication should be started, and it should be continued unless and until doctor or clinician asks the patient to stop the medicine.
Okay, so while taking medication, what are the most common side effects people should look out for?
Another very important aspect that we should discuss at this point, that whether the medication that we usually use for treatment of hypertension Do they have any side effects? They do have some side effects, and we should make the patients aware of the common and the kind of serious side effects that can happen. There are different groups of antihypertensive medications which can cause certain side effects, like at times there can be swelling of the legs, there can be excessive urination, there can be fatigue, there can be persistent cough, weakness, or some other kind of side effects. But in most of the cases these side effects can be very well taken care of. At times we need to change the medication or need to adjust the doses a little bit, or we need to use a different combination of drugs which can very well take care of the side effects. So this side effects should not be a factor that should keep the patients away from medication or treatment. Ideally, all hypertensive patients who require treatment should get the medications.
Okay, so now my question would be, if somebody's blood pressure improves, can they come off medication, or it's a lifetime commitment?
Whenever a patient comes to the clinic, her blood pressure is checked, but apart from that, home monitoring of blood pressure is also important. We suggest our patients to go for blood pressure monitoring at home as well, and nowadays we have automatic blood pressure monitoring machines at almost every household. So but don't go overboard. No need to check blood pressure every hour or every 15 minutes or 30 minutes. Just check once or twice a day in the initial part, and once patient gets stable on some medication, this can be done 2 to 3 times every week, and later on you can do this on this frequency, like once or twice a week for continuous blood pressure monitoring at home. And whenever the patient visits the clinic, definitely the blood pressure should be checked, and we should compare the home blood pressure and the clinic blood pressure as well.
You just mentioned that people should reassess it regularly. How often people should check their blood pressures, and what's the best way to do it right?
There are a lot of risks involved. That's why we all are so concerned about hypertension, and there are a lot of undiagnosed cases in the community whom we could not diagnose because those patients never visited the clinic or never checked their blood pressure. For them also, there are a lot of risks involved. The most important things are the risk of end organ damage, like having stroke, which is a very common thing nowadays, and having a heart attack or a renal failure, like that means the kidney dysfunction. So all these kind of serious medical conditions can happen if hypertension remains uncontrolled. And one very important aspect is hypertension in pregnancy, which needs to be controlled on a very urgent basis, because that can cause a lot of pregnancy complications.
What can happen if high blood pressure is untreated for years? What are the body parts which are most at risk?
So, in a nutshell, I could say that hypertension should be diagnosed at the earliest possible opportunity, and the treatment, including drugs and lifestyle modification, should be started at the very beginning.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to our doctor for such valuable insights. Remember that hypertension isn't just a number, it's a signal, and with right practices, we can manage it effectively. If you like the podcast, please don't forget to like, share, and subscribe, and leave a review for us. Just remember, stay informed, stay proactive, and most importantly, stay healthy. This is Sumitra, your host, signing from the podcast Win Over Hypertension.